E aí, gente, bom dia. Meu nome é Lucas, como vocês já sabem, eu sou da CLEV, sou norinho da CLEV, e é com muito prazer que eu venho apresentar para vocês nosso Café com Prosa. Espero que esteja tudo ok aí com o som e qualquer coisa vocês vão avisando aí se tiver algum eco, alguma interferência. Eu vou mudar pro inglês agora para apresentar para vocês nossos participantes. Hoje nós vamos ter 3 países aqui representados: o Canadá, o Chile e a Venezuela, e acredito que vai ser muito importante para vocês ouvirem a experiência que cada país passou durante a pandemia. Wait. First of all, we're gonna have Angie and Kila. They're both from Canada, and Angie is the north in or out from Canada, and Kila is the north. Paloma, she's the Chile. The third one will be Fabiola, who is the president of FVS Venezuela. Thank you guys for being here with us this morning. I really appreciate you guys are here. I know it's like really early there in your countries, but thank you so much. I hope everyone will like it, and it's gonna be really helpful. So you guys will share with us your experience through the pandemic, and we'll learn so much from you.
Thanks for having us.
So now we're gonna have Angie and Kila presentation. So feel free to speak like as you want.
Great. Hi, everyone. Welcome. So as Lucas said, my name is Angie Woodbury, and I am the new Neo and Nori out for CFMS Canada. And I'm joined by my lovely partner here, Kilan, if you'd like to introduce yourself.
Yeah. Hello, everyone. My name is Kilan. I'm a third-year medical student at McGill University in Canada, and I'll be the next National Officers of Human Rights and Peace for the CFMS.
So I'm going to get my screen shared to show our presentation. Feel free to put some questions in the comment box if you have questions. We can also answer some questions at the end of our presentation. I see there's some good mornings, bom dias, good morning everyone. So let me just share my screen. And all right, if everybody can see my screen, welcome again. This is our perspective about COVID-19 and how it's impacted Canada. We are not epidemiologists. This is just sort of our personal opinion and kind of some information that we've collected. And we're going to be talking about many different areas of Canada because Canada is such a huge country. So I'm just going to start out with we were very lucky in that we have access to a lot of information, and our government has many public health websites with data showing the impact of COVID-19 around the world. So this is a map, not around the world, around Canada. This is a map of total cases since the beginning of the pandemic. And it's an interactive map. This is just a picture of it, but on the interactive map, you can go by provinces. Canada's broken up into 10 provinces and 3 territories, and you can see the graph of total cases. We had a lot of interactive websites for each province, and Canada had free testing. So how Canada's healthcare system works is that we have a public healthcare system that's like privately delivered but publicly paid. Testing was free throughout the country, and it was fairly easy to get testing done. So this is just some pictures of people lining up to get testing. I know in different cities they had a drive-through testing where you could pull up to a location and they would do your swabs in your car, and it was a nasal swab. Other places had walk-ins. Sometimes you had to make appointments for testing. I know depending on what province you lived in and what time of the pandemic it was, sometimes you weren't allowed to get tested. I know where I lived, originally we were only testing people who had recently traveled outside of the province or the country in the last 2 weeks and had symptoms. So at first, if you had traveled but had no symptoms, we weren't testing. So we weren't testing asymptomatic people. And if you had symptoms but hadn't traveled, we weren't testing. So that's kind of what it was like at the beginning, but it was different in every city. I don't know, Kilan, if you want to add something to this.
Yeah, I'll add something. So the picture on the right of the screen, as you can see, this was taken in Montreal. So although the testing were mostly free in many places across the country, a lot of the times, so the delivery of the testing couldn't meet the demand. So a lot of time people were waiting long hours outside, or they have to call in advance and only be able to take an appointment a few days after their call. So a lot of times you have this gray period where people might be symptomatic and carry the virus, but are kind of in this limbo where they don't know if they are COVID positive, but they don't really know if they have to stay at home or they need to quarantine themselves.
Mm-hmm. And for the results, there were several different ways you could get results. You could go online. Most provinces had portals. You could make an account online and your results would be posted there. Other times you had to call into a phone center to get your results, or a member of public health would call you to tell you what your test results were and to discuss contact tracing if you had been exposed to someone who had COVID-19, or if you had COVID-19 and exposed it to others. I know students across the country were helping with contact tracing and were giving people medical advice about how to isolate at home and what does that look like. So it's okay, I'm going to move on to the next slide unless you have anything else to add.
I know, that's good.
Okay. So we did have a lockdown. It was sort of stricter in some places more than others. Our border between Canada and the US has been closed. I don't know exactly when it closed, but it's going to be closed until September 21st. They keep extending that deadline as people don't feel comfortable with letting tourists from the States come into Canada because of the situation there. The thing is that it impacts delivery of goods, like groceries and like things that we import from the United States. I know that they have kept some part of that open so we could still get resources. But that impacts certain communities that rely on groceries and things like that being brought in. Different provinces had different rules about how many people were allowed to gather at one point, as well as each province closed down and opened up in at different times. Maybe Kilan, if you want to speak to Montreal, I know that a friend of mine lives there, and at one point you couldn't be in groups of 2, and that people were getting fined to if they were seen in groups more than 2 people. Is that right?
Yeah, that's correct. So at the beginning of the pandemic, in the first, I would say, a few weeks of the lockdown, the rules were pretty severe. So you had to, keep your physical distancing at 2 meters away from each other. And then actually the police were patrolling the streets and also parks. And a lot of people received fines up to, I think somewhere close to $1,000. Just for being outside and not respecting the social norms. But I'm gonna be presenting a little bit more afterwards. But Montreal was heavily hit by COVID-19 at the early phases of the pandemic, so it made a lot of sense for people to react this way.
Mm-hmm. So maybe also if you want to speak on our economic response and kind of how the government was helping people. Yeah,
of course. So I'm pretty sure it's the same situation a little bit everywhere around the world. But because of the pandemic, the economy has been heavily affected in most countries. So regarding Canada, the government was very fast in order to provide a response. And the response was mainly focused on supporting workers and employees. So a lot of people lost their jobs because of the pandemic. So a lot of the non-essential services, since they're closing down, they don't need the workers anymore. So a lot of people were left without a job. And because of this, the government actually invested a emergency stimulus plan of more than $200 billion since the beginning of the pandemic. And depending on where you live, so depending on each province, some provinces do have another supportive plan for the workers, but there's two major on the federal level, there's two major plans that people could apply. So they're called the CERB and the CESB, standing for Canadian Emergency Response Benefits, and also Canadian Emergency Student Benefits that was added a little bit later on. So I'm not sure if you can clearly see on the screen. If not, just feel free to do a quick Google search. So for a lot of people who have lost their jobs, you can just go online to the Canadian Revenue Agency's website and also apply for those funds. For the student benefit one, it's you receive the amount of $1,250 per month. There's certain criteria that you have to respect. For example, you have to be like a full-time or half-time student, having graduated high school in 2019, 2020, and there's a few other details like this. Personally, I did apply to the CSB for the past couple months, just because usually during summer I do tend to have a summer job, and this year because of the pandemic, it was very difficult to find an appropriate job on the side. And also for the CERB, this is mostly supported for low-income families and also people working full-time. Again, there are certain criteria you have to respect. For example, I think you have to prove that you make around $5,000 in salary for the period you're applying for. If you're not working, that means you're losing about a certain amount of money. And if you respect those criteria, you're eligible to apply for those programs. And how it works is that most of the time, people, when they apply, they automatically receive it, and then later on in the weeks and months afterwards, the Canadian Revenue Agency is going to do an audit of all the people who apply to see if they are really eligible or not. If, for example, someone is found to be not eligible, they have to repay the amounts that they received.
I find that kind of interesting because there's people getting sent money that they, not that they don't need, but that it's like over the amount that they expected, and then they have to try to find a way to send it back. So it's kind of complicated.
That's it.
Yeah. So now we're just going to talk about specific areas of Canada, because Canada is such a large country, and each province and community was affected differently. Before we do that, are there any questions in the comment box? I can't see the screen.
I don't see any questions.
Okay.
All right. So moving on to the different provinces, how they responded. So just wanting to clarify before, so in each province in Canada, the provincial government manages their own healthcare. The healthcare ministry kind of manages on their own. So it's not, most of the time, it's not a federal level budget, but it's more like each province is managed their own side of things. So we kind of regrouped a few provinces together just to make things easier and faster. So I'm going to start by presenting the provinces that we call the Maritimes in Canada. So those are Newfoundland and Labrador, Prince Edward Island, Nova Scotia, and New Brunswick. So those are smaller provinces in the east coast of Canada. So what the Maritimes, how the Maritimes responded to COVID-19. So since they're very isolated provinces, their numbers have been pretty low since the start, and they were able to, flatten the curve faster than the other provinces in Canada. So together, those four provinces got together and created this what we called the Maritimes bubble. So since they have a similar situation, they were able to manage everything together. And basically, in this Maritimes bubble, a lot of the non-essential travelers from, the other provinces couldn't go in without a valid reason. And even if you do have a valid reason, or for example, you are a resident of those provinces, but have gone out to Quebec to study. Once you go back, you do have a 14 days quarantine that even up until today is still maintained. So if I were to visit, Nova Scotia, because I have family over there, I'll still have to get to my destination, quarantine myself for 14 days before I could go outside. And also for the wearing of a non-medical mask is required in most indoor, outside public areas, and also public transportation. In the cases of Ontario, so Ontario being the most populous province in Canada, their numbers have been pretty consistent. It's still increasing, but it's not. We haven't seen a huge spike in terms of numbers. And the public health measures in Ontario are actually pretty relaxed compared to the other provinces at the early stages of the pandemic. Masks were not required, so they were not mandatory up until I think early May, whereas the other provinces were very fast to react on this. So schools were shut down at the beginning of the pandemic as well, and the Ontario province is reopening different areas of different business areas in a 3 stages plan. So in the case of Quebec, so I live in Quebec, so Montreal being in Quebec, this is the part where I can share a little bit more. So Quebec was heavily hit at the beginning of the pandemic. I think up until today, we still have the highest numbers of positive cases. So how Quebec reacted at the in the first couple of weeks, just like we mentioned early on. So very, very strict public physical distancing measures, with people receiving fines in Montreal, and all those things were kind of necessary in order to flatten the curve, just because the numbers were very scary at the beginning of the pandemic. So the government was very fast in closing down all the non-essential businesses within a week since the pandemic was declared. I still remember the day that the provincial government declared that we're shutting everything down. I was in class that afternoon, and we had like a very big student event scheduled for that evening, and then we had to cancel everything within 3 hours that afternoon. So another point that Quebec was heavily hit was in the elderly care homes. So we saw a lot of the deaths happening in those centers. So because of that, I think up until the end of May, there were no visits allowed in a lot of the hospitals and also elder care homes, and people were not allowed to go outside. So it's a very difficult moment, just because for people in palliative care, people in end of life care, they couldn't spend their last days surrounded by their families. Of course, some students were able to kind of come in and distribute iPads to the hospital, so at least they were able to kind of communicate with their family. But it was a very, very difficult period at the beginning of the pandemic. And also for the wearing of non-medical masks, it is required and mandatory in most public areas and public transportation. You can actually be denied service if you don't have your mask on you. And also, another thing, since Quebec's numbers are high, the provincial government actually have an action plan for potential second wave that is scheduled in fall if it were to happen. So this is a fun little infographic I found prepared by the provincial government of Quebec, just to kind of give a little resume of which areas are slowly being opened. So for example, I think he says that most places are most business areas are open except for summer camps, some close contact sports. All those things are still to be avoided.
Okay, thank you so much for that perspective of the kind of east side of Canada and Quebec and Ontario. Now I'm going to talk a little bit about central Canada, the prairies, and then the Rockies. So I live in Winnipeg, Manitoba, Canada. A lot of people don't know where that is, but it's in the smack dab middle of the country. So in Manitoba, we had the benefit of kind of time with watching COVID cases happen in Toronto and Montreal and in Vancouver, areas where we had major international airports and a lot of cases were coming in at the beginning. So we had time to kind of see what other provinces were doing. And then when we had our first case, I think it was March 11th, by March 13th, we decided to shut everything down. So yeah, same with Kilana, was in class. It was our last day before our spring break, like our 1 week vacation from med school. And the university said, like, don't go anywhere for spring break. If you do, you might not be allowed to come back. You might get stuck in whatever country you go to or whatever province you go to. We were advised that school might be online from then on, but we didn't know what was going to happen. So in Canada, we have usually 3 or 4 year medical programs. My university is a 4-year degree, so our first and second year students, they are the pre-clerkship, they're doing like lectures. Everything was moved online. There was a lot of confusion. It was changing every day in terms of, are we going to have our exams canceled or postponed? Or are we going to do them from home, online? We weren't really sure. Clerkship students, so those in years 3 and 4 who were like on the wards during the rotations, those students were sent home. Clerkship was put on hold, and that was for the safety of the clerkship students, because they didn't want students in an environment if there wasn't enough PPE to protect them. There was also a lot of services that were canceled, like elective things that just for the time being didn't happen, and so there was no point in having students on those wards. How medical education works in Canada is that after you finish your degree, you go into something called residency program, and that's where you train in your specialty. And in order to get into residency, we have a matching process where students interview and then get matched with a program of their choice, and then go on to do further training. So the first part of that matching process had happened in person, but then when the pandemic happened, we had to switch to an online interview process. I think it was via Zoom for some people, and students didn't have the opportunity to go to other universities to see what their programs were like. The 4th years ended up graduating online. I think some universities did online graduation ceremonies, and everybody was alone in their own houses, which was disappointing for them, but I'm glad that they were able to still graduate on time. I know other countries have advanced people's graduations or said, you know, you just start right away, you're a doctor. But I guess in Canada, they decided they were going to graduate on time. There was a licensing exam that usually final year students will write, and that had been postponed. But most people did start their residency programs on time in July. Where I live, you know, things have started to open up again, and the public memory of kind of how serious it was at the beginning has started to fade, and people have stopped taking it seriously. There's been a few restaurants in Winnipeg that have been fined because they've been over their occupancy limit for patios. People were only supposed to have like 75% of their capacity, and instead there was people, you know, all on this patio, nobody distancing, nobody wearing masks and things like that. You know, as a med student, I just want to say that, like, I have a privileged position, and that, you know, I was able to stay at home and do my classes from online. You know, like, I had enough income that I was able to still buy my groceries and have someone from my household either order groceries or go out and get them once a week. A lot of people are not so lucky, and either had to continue working to provide for their families, or they were in a position where they were able to stay at home and isolate. And I think it's important to mention that, you know, like, marginalized communities, like people who are homeless, they can't really socially isolate or you know, quarantine themselves. They may not have home. Several shelters had to limit their numbers of beds and like the number of people that they were allowed to house, just because of infection risk. So it's really difficult for those people. Also, several community organizations and food banks had to temporarily pause operations while they figured out how to do it safely. So that really impacted some marginalized communities. Moving on to the Rockies and the West Coast, like Alberta and British Columbia, they had some of the highest cases at the beginning, and they had some of the most aggressive measures when cases first started. People who were supposed to be going away again on spring break were discouraged from traveling. One area that was hit pretty hard at the beginning was personal care homes for seniors, specifically in Vancouver, North Vancouver. There was a lot of cases, and the elderly population were impacted. Many home care workers were asked to only work at like one home care facility, not at other facilities. That's difficult though, because sometimes workers, go from house to house delivering home care, or they go from different personal care homes, and that's just the nature of how their job works. So that was kind of difficult to control. Just to kind of, in the interest of time, just to keep going, it was different in every city and every province. And some communities were impacted more than others. Specifically, like our Indigenous population, some people living on reserve were more impacted than people in the city, just to do because of measures that public health authorities were impacting. I don't know if Kilan, you want to add to this?
Yeah, I'll briefly present about the Indigenous perspective in COVID-19. So there has been a lot of structural inequities between the Indigenous communities and the rest of Canada for a long period of time, and this COVID-19 pandemic kind of brought this even more forward. So a lot of things that we talk about, those inequities are access to healthcare, access to fresh water on the reserves, affordable food, effective telecommunication, and sometimes even for electricity. It has been a very major problem for people living on the reserves. So on the federal level, the amount of money put aside to limit the spread of the virus in those Indigenous communities were around, I think, 1% of the total number of money put into it. But in comparison, the Indigenous community of Canada represent 5% of the population. So just in terms of the budgeting from the federal government, you can see that there's already an inequity. And just another very striking example is that pretty much everywhere in the world, washing hands, hand washing, is proven to be the most effective way to prevent the transmission of the virus. However, even though the government has been spreading the information on appropriate hand washing, a lot of the First Nation communities living on the reserves are still lacking access to clean water. So this is just another problem that Canada is facing, and this is kind of my grain of salt I'm adding to the presentation as the NORP, just to say that this is something that has been ongoing for quite some time in Canada, and something that we're advocating for in terms of better access to healthcare, better access to clean water. Oh, I think, do we skip a slide? Oh, it's okay. I think it just didn't load, but so I'll just add also like a brief mention. Angie already mentioned a little bit on how our medical education was affected. So I think for most Canadian schools, clerkship starts was postponed. For me, for example, I was scheduled to start in the end of July, and now my start of clerkship is delayed until mid-October. So I have this kind of extra 3 months where I'm kind of left to doing nothing. And also depending on which school you're at, some of the clerkship rotations might have been cut shorter. Some might have been canceled as well. In terms of electives, so usually we're allowed to apply to other medical schools in Canada to do an elective rotation for a few weeks, to up to a month or 6 weeks. And then because of the pandemic, most schools have canceled the away electives for the graduating year of 2021. And for the class of 2022, we still haven't heard any specifics, but it might still be the same case for us as well. And also for the licensing exams for the graduating students, some of them were held in person, but a lot of them decided to move it online. And I mean, that's what I heard, but apparently the online service that they hired to run the exam, were met with a lot of challenges. Some people weren't able to take their exams. Some were doing their exam halfway and the website crashed, so they have to redo the whole thing. So those are some other challenges that were met by medical students across Canada for the past few months.
Yeah, and I know we're kind of running short on time, but we just wanted to quickly add again at the end that CFMS as an organization has taken on some initiatives, as well as many medical students across the country stepped up to volunteer on their own to do to help with this pandemic. So, for example, CFMS signed on a call to action with 12 other organizations to ask the government to make sure that there was enough PPE and that there would be standard recommendations for PPE use around the country, because they were concerned that if there was no guidelines, people would be trying to reuse them and sanitize them improperly, and that could cause problems. CFMS also developed something called the COVID-19 Community Care Initiative Grants with help from our sponsor, MD Financial Management. And so that was $10,000 available for different med societies in each university to apply for grants for initiatives that they wanted to create. So that was a really cool grant and like amazing opportunity for people to create initiatives. So for example, PPE drives, volunteering to communicate with seniors who were in isolation, social media campaigns to encourage people to continue going to their doctor, because many patients were afraid to seek healthcare because they thought they'd get COVID if they went to the hospital. We also had some Facebook groups started for wellness to support med students to each other, and CFMS Heart, which is an organization like a part of our global health that advocates for planetary health, signed a letter to MPs, so members of our government, to promote a sustainably and environmentally conscious post-pandemic plan. And Kilan is a part of CFMS Heart, so I'm sure you have something to add as well.
Yeah, for sure. I'll just add a few more points to what you mentioned. So as part of the CFMS initiative grants, and also for in terms of PPE drive, so in Canada, one of the major challenges that we met was the lack of personal protective equipment. And I think it's kind of a similar case in all major cities across the country. So a lot of time people are kind of either making their own or reaching out to local businesses to kind of produce, hand sanitizers, face masks, and such. And so I think one group of McGill students received some money from the CFMS initiative grant, and they were actually 3D printing face shields from their garage, and then afterwards distributing them across the healthcare system in Montreal. And just going back to also the CFMS Heart. So for people who don't know, CFMS Heart stands for Health and Environment Adaptive Response Task Force. And it was this task force that was created in 2016, and since then kind of evolved into this network of students who are passionate about sustainable healthcare and also planetary health. So I have been part of it since last year, and then we work on a lot of initiatives trying to promote planetary health, just like Ange mentioned, and also we're working into this new project of making hospitals greener in the future. And also we work closely with CAPE, which stands for Canadian Association of Physicians for the Environment. And CAPE is this nationwide association as well. And they came up with this open letter to members of the parliament that, were signed by a lot of physicians, healthcare professionals, medical students across Canada in order to kind of push forward, a greener recovery in terms of the economy after the pandemic.
Great. I'm going to stop sharing my screen for now. Thanks everyone for listening, and we'll check out the chat and see if there's any questions.
Yeah, there's a few questions in the chat. So I can answer the first one, and you go for the second one, Angie.
Sure.
Okay. So the first question was, hey guys, Brazil has been suffering a lot from people denying the pandemic, going against science, and blindly believing in miraculous cures. How are the Canadians dealing with this kind of issue? So it is something that is also very present, I'll say, in Canada or just in North America in general. So we have, being in a very geographically close and also socially and culturally close to the United States, we do receive a lot of news from the other side of the border. So I mean, there are still people sharing a lot of this information online. I think there was this campaign called hugs, no mask, or something like this. So people denying, physical distancing, people blaming the government of stepping on their freedoms on having a mandatory the mandatory face mask wearing in public spaces, physical distancing, limiting the numbers of people you can see, the people you can receive at your house. So I mean, personally for myself, being in a very medical environment, I tend to see those posts as something not to laugh at, but as also almost like a meme. You see them passing through your social media, you see people screaming about this in the streets, you just think how can people believe this? But on the other hand, you have to kind of also understand how some people who might not be so aware of how big of a deal the COVID-19 pandemic is, and also not being in hospitals, not having close family members being affected. Most of the time people just don't realize how those can be a problem. I know in Quebec, there's actually people who went outside to protest physical distancing without respecting the physical distancing measures. So, they were protesting in front of the parliament, and, that's made a huge deal in the news. But I'll say, I think in general, people are very respectful of the public health measures in every provinces. There's always going to be some small numbers of people who are going to go against those measures, but I'll say it's a minor thing. And right now in Canada, we're kind of into this phase where every province have flattened the curve, at least for now, unless we're expecting the second wave. So we're able to kind of freely travel around the country, across different provincial borders. And also recently, the federal government created this contact tracing app that made everything way easier to receive any news about if people around you or people you have been in contact with were COVID positive. So just to add a little bit to that, being able to kind of travel around the country. Personally, right now for myself, I'm doing this road trip across Canada, and everywhere I go, I respect the local public health measures, and I haven't had any problems with this.
Great. Second question was, what about the hospitals? Like specifically, how have organizations dealt with increasing number of patients? I feel that at first, a lot of hospitals were limiting visitors or having no visitors at all, just to try to decrease the number of people on the facilities. I think at first, actually, a lot of hospitals had increased number of patients as people were coming to get tested and cases were happening. But then later on, numbers, specifically in emergency rooms, decreased because, again, as I mentioned, people were afraid to seek care. There was less presentation of people with heart attacks, not because there was less heart attacks happening, just because less people were going to emergency room to seek care for that. So I don't know specifically because I haven't been in the hospital. I don't know how they've been dealing with how many patients there are. I think it hasn't been as severe as it has been in other countries where they were having to choose, who to ventilate and what care to give. But I don't know if I'm really the right person to speak to that because I'm not at my level of training yet.
Mm-hmm.
I think that was all the questions, unless there's any more. Anything from our fellow hosts?
Thank you for the awesome presentation. It was really, really awesome. And I have a question, actually. What about distance learning? Have you guys had it since the beginning of the pandemic?
Yeah, it has been mostly distance-based learning. So I think 100% of my learning since the beginning of the pandemic has been hosted on Zoom. So for me personally at McGill, at the end of our second year, we already kind of starting to transition into a clinical rotation. So a lot of our rotations that we're supposed to have, we had sessions with a hospital staff or a medical resident, and we're kind of just practicing our clinical knowledge, clinical skills on a simulated situation. But progressively, we are starting to go back to campus. For me, last week we did have a in-person session at the university that we were required to go and respect social distancing, wear a medical face mask, and all those things.
I would agree, the same thing for me.
That's nice. So thank you again. It was really awesome. If you have any other questions like here in the chat, we can answer you at the end of the presentation, right? All right. So now Paloma, who is the new in from Chile, she's going to speak a little bit about her country for us. Thank you, Paloma, for being here.
Hi everyone. I will share my screen right now. So so can you see my screen?
Yes, we can see it.
Okay, so I'll start. Well, hi everyone. My name is Paloma. I'm the new in from UFMC Chile, and I will talk today about the pandemic here in Chile, which is my country. So this is the presentation outline, the topics that I'm going to discuss with you today. So first of all, about the overview of COVID-19 here in Chile. Here you can see the number of our active cases, recovered cases, total cases, and our mortality. You have to know that we are the fourth country with most cases and with most deaths in South America. So the situation has been hard for us. Here's a little overview. Our first case was on March 3rd, and about a week later, our government decreed a state of catastrophe for 90 days, and they extended for another 90 days on June 15. Also, partial lockdowns and quarantines were established, hitting the economy of our country. By April, the unemployment reached the 9%. So this was very problematic for us because, as you can see in the next picture, a new wave of protests sparked, mainly in Santiago, because people were starving, they didn't have enough food, they didn't have their jobs. So this situation were mostly in the sectors of lower socioeconomic incomes. And the government responded by delivering about 2.5 baskets of food and hygiene products, mainly to the vulnerable and the sectors of lower economic incomes. Also, in May 15, the quarantine extended to the entire Santiago metropolitan area. So by June, we have our peak of positive cases. I will show you a chart in the next slide. The Minister of Health, Jaime Mañalit, at that point, he affirmed that the deaths from the pandemic were counted as recovered ones, and the asymptomatic were excluded from the count of those infected. In addition, they reported to the World Health Organization a greater number of deaths than the reports that they gave us here in Chile. So after this, he resigned, and now we have a new Minister of Health because as the population, as Chilean population, we thought that he was like kind of lying to us about the deaths and the people who were counted as positive cases here in Chile. So here you can see a chart of the number of cases per day. As you can see, our peak was in June with about 6,000 and 7,000 cases per day. But the cases begin to drop in July and August So nowadays we have like about no more than 2,000 cases per day, which is pretty great considering that we reached the 7,000 cases per day. Here you can see a chart about our PCR test. So the PCR test has been increasing over time, and currently we are the country with has the most PCR tests performed in South America. So that's pretty great, and our current positive rates it's about 6.7%. So we're getting better about this issue. Mortality, you can see here on the screen. Basically, it's a chart with the ages that has been of our deaths. So, well, we have a lot of deaths considering the number of our cases, and mostly they are from the high-risk groups to 60 and 89 years old. So, our government measures. First of all, the government decreed quarantines, customs, and sanitary cordons in specific areas of the country to control the spread of the virus between regions. So the first measure was the isolation quarantine, which, as you know, is a confinement that must be carried out with people confirmed with COVID-19, those who had close contact with positive cases, and also the people who have pending results of their PCR test. The second measure was the territorial quarantine. It means that not all the region has to stay home. It is locally in different cities and neighborhoods. Also, we have the preventive quarantine, which is a confinement for high-risk groups. For people entering Chile, they have to stay for 14 days in quarantine. We have this thing called the sanitary customs, which are sanitary control barriers that are established at a specific point of control access between one area and another. And also the sanitary court, which is a measure that prohibits entering and leaving a certain place. We have the curfew as well, between 22 p.m. and 5 a.m. The curfew started in March, so we still have the curfew going on. Another measure was the creation of these health residencies. As you can see at the left of my screen, here is a picture of one of the residencies. It's pretty comfortable. There are places that are for those people are infected with COVID-19 or had close contact with a positive case, and they do not have the possibility of doing their quarantine properly isolated in their houses. So in addition to accommodation, people will receive food and they will also receive medical monitoring. Actually, I have a friend that she had to stay at these health residencies, and she told me that they are pretty comfortable. So, you can see here that they look nice. About our healthcare system, in general, we have a public and private system, which are both paid. The Ministry of Health took control of the management of public and private infrastructure to face this emergency. So the beds and the mechanical ventilators are managed by the government and centrally. This means that if you need this assistance and, for example, the public health cannot attend you, you can go to the private system. Also, we have this called telemedicina, which is basically when a doctor attends you online. Well, additional measures that has been taken. First of all, of course, the restriction of massive events. For example, Lollapalooza, which it was supposed to happen in March, but it didn't. Also, the protection of economic incomes. This was an issue, as I told you before. The people, the unemployment rate raised up, and people were starving. They had nothing to eat. They didn't have enough money to pay their bills. So our government was providing food, and also the possibility to apply into a system in order to get some cash to them so they can pay their bills and stuff. About commerce, well, stores has been closed. Only the essential ones are open, for example, supermarkets or drugstores and so much, but only the essential ones. Shopping and that kind of stuff is not allowed. Of course, we have the mandatory use of mask. About transportation, it is still working. Basically, they only reduce the hours that has been working, so you have to respect the social distancing, and the transportation closed earlier than before. About our border control, as I said before, if you come from another country, you have to stay in quarantine for 14 days until you enter to the country. And also, our government are not allowing people to enter, not from all of the countries. We have online work and the suspension of school classes. So basically, everything is online nowadays. Maybe in your country, it happens the same. About university, well, they are closed until further notice. I want to talk a little bit about medical students, because we are medical students. Well, we are not allowed to attend to the hospital, to our clinical practice. So most universities will prioritize the internships of 6 and 7 year. So the rest of the students will have to wait, or we will have to recover our clinical practice in the summer or early next year, like in March from next year. Also, students have been offered to help out in hospitals, but mostly with administrative work, not rather than patient care. And this offer is only for those students who are on their last medical year. About social distancing, well, in general, we are kind of respecting social distancing, but not completely. For example, a couple of months ago, we have these people who organized a party, and there were like 400 people gathered around dancing in a party. So it was pretty irresponsible. Maybe, of course, there are people that are not taking this pandemic seriously, but we also have these people, as I told you before, that they need to go out because they need to work. They need to get some money in order to provide their families. So we have like a lot of cases with people that do respect this social distancing and people who don't. Well, actually, we are on our reopening phase. So our government has taken some measures. It is divided in 5 phases. So the first one is the quarantine, of course. You must stay home, as I said before. We are currently on our transition phase in some neighborhoods and cities. So this means that you can go out to Monday through Friday, but you can only move within places that are in this transitional phase. Also, social and recreational gatherings of maximum of 10 people is allowed, and in open spaces, in open places, 5 people in closed places. So, for example, in my region, we have I think, like 3 neighborhoods that has this transitional phase. So where I live, I am not in this transitional phase, so I have to stay home. The third one is the preparation phase, which means that you can go out every day of the week, not only Monday to Friday, but also you have to stay in your neighborhood, which has the transitional phase and preparation phase. You cannot go out to a place with has quarantines. Also, to participate in events and gatherings, there are allowed 50 people. So the next phase is the initial opening phase, which allows theaters, cinemas, and similar venues to open with a maximum attendance of 25% of their capacity, and also without the consumption of drinks or food. Restaurants and cafes are allowed to open as well, but they have to respect the social distancing. For example, you cannot have like many tables and that kind of stuff. Also, non-critical elective surgeries may be rescheduled. We have to remember that due to COVID-19, our hospital were taking care mostly of those patients. So other patients that have other illness or issues of medical issues, they have to stay home. So at this phase, the surgeons can reschedule their surgeries. Also, if the situations allows us, the schools will be opening as well. I don't know if universities, it depends on the situation. And the final phase is the advanced opening, where everyone, including people over 75 years old, can go out, but not go to quarantine places. Oh, so I didn't say it before, but the high-risk people, which are people of 75 years mostly, they cannot go out on the previous phases because they are of the high-risk group. So they have to stay home, making this quarantine. Only in the advanced opening, they can go out and this. So at the advanced opening, you are allowed to participate in events, social and recreational gatherings, up to 150 people. Also restaurants, cafes, theaters, cinemas, and similar venues will open, of course, but the attendance will raise up to 75% of their capacity. Also, pubs, clubs, and gyms with a maximum attendance of 50% of their capacity. So they can open as well. So I want to say something about this, where I told you that we are on the second phase, which is this transitional phase. It's pretty it's a bit complicated because we thought that places like, for example, big shops and people, or these big stores that are not allowed to open, I think, on the initial opening. So they already open on this transitional phase. So I think that our government has not been taking the right measures about this. And I'm afraid that our cases will start to raise up again because of this. People are starting to going out a lot recently. So what happens now? People are not taking the pandemic seriously, I think. They are going out a lot, but I don't know. I think that is our government that are not taking the right measures right now, because we have to consider that, as I told you before, Chile is the fourth country in South America with most confirmed cases. So I think that we have to improve in order to not have too many cases from now on. Well, and in medicine, we have lost our clinical practice, and we will be seriously affected in terms of knowledge. For example, I'm in my fourth year of medical, in my fourth medical year, and I think that I'm not going to the hospital until March or January, so it is a lot for us. But what can we do about this? I give you some examples. For example, at my university, we have these online simulations with patients. It's pretty fun, actually, because we cannot attend to the hospital. So it's pretty boring being at my home and learning, but not seeing patients. So well, these are pretty good simulations. Also, we had our National General Assembly here in UFMC Chile, and it worked pretty well. So I think that, yes, the situation is bad mostly, but I think we're getting better these days. I hope that the situation keeps like that permanently. So that's all. Thank you for your attention. I don't know if you have some questions for me. I will stop sharing my screen.
Hey, Paloma, thank you for your presentation. It was awesome. I actually have one question. Before the pandemic has started, I had an incoming from Chile, and she and I, we became like really close friends. So I saw that she was like getting some contraseñas, like passwords, to go out. Is it like in the whole Chile? Because she's from Arica, maybe, I don't know, north of Chile. But I don't know if it's like in the whole country. You guys have to pick like 2 contraseñas, and you can go out only twice a week.
Oh, yes, yes, that's right. So in order to go out, you have to enter online to our police website, and they will give you a permission. So you have to show your permission on the street, and yes, you are allowed to go out 2 times per week, only 2 times.
But what if people don't respect it?
If you don't respect it, you get busted. The police can take you to the police station, so I don't recommend to don't respect this measure.
Nice. So I have a question for you.
We have a question. So are these the students? Well, about this question, as I said before, no, they are not being forced to work in areas where there is COVID, and there is no pressure about this work. As I said, it's mostly administrative work, so they are taking notes of the positive cases at the hospital and helping with other issues, but they are not taking contact with these COVID patients because it's pretty irresponsible from our universities to take our students to take contact with positive cases. Also, there is no pressure. So basically the university asks you if you want to attend to the hospital and help, but if you don't want to, they will not force you to do anything. And yes, they have the protective measures that they need to have to attend to the hospital.
Nice. Thank you again. And if you have any other questions during like Fabiola's presentation, you can answer that after we finish it. Okay?
Thank you.
Thank you. Now I'm going to present you guys Fabiola. She's the president for Venezuela NMO, and she's going to speak a little bit for us about her country. Welcome, Fabiola. Thank you for your presence here with us.
Hi, and thank you for having me, Lucas, and thanks to all my partners that spoke before. It was like really an experience. I didn't know about how Canada and Chile and many other countries, I don't really know how you're handling all the COVID situation, and I think it's very important to treat topics like this internationally. So thank you for this, DENEM-Brazil. First, I want to give you a small background about Venezuela's situation so you can really understand what's happening here since the COVID pandemic started in March. So in Venezuela, we are going through a severe humanitarian crisis, maybe since 2015, but it's been getting worse each year since then. So right now, the minimum, I'm sorry if you hear like weird noises, it's my lovebird. She likes to hear people talking and then she just talks over you. So yes, I'm sorry. So yeah, it's been getting worse. And right now, for you to understand a little bit how the humanitarian crisis has been getting worse with COVID, it's important to know that the minimum wage of Venezuelan people is currently like $1.50 per month. So you have to live with $1.50 for a month, and the Venezuelan economy has been passed since last year maybe to a US dollar economy. Even when the Venezuelan people don't earn dollars, we have only bolivares, but everything is in dollars right now. So even before the pandemic, Venezuelan people were starving, they were homeless, they were unemployed. It's like a really severe crisis, but how can that with this background, how can we speak about COVID? So I didn't make a presentation. Also, I wanted to clarify that because all of the data we're going to be handling to you today is unofficial. Our government's been given like a small peek of what's really happening with the pandemic, but everything I'm going to talk to you right now is really experiences and things I've lived and my animal has lived and my friends and co-workers has lived. So it's just unofficial. That's why we don't have statistics or data or a presentation. I can show you that because I'm not talking with official presented data. Our country doesn't have that. It's not really that organized, and mostly it's forbidden. So even if we get the data, we cannot publish it because it's forbidden. So yesterday, Venezuela registered 600, I think, let me search for the, yes, 621 cases of COVID, and for a total of 38,188 cases, with 27,000 people recovered approx, and 317 deaths approx. Again, these numbers are given by the government and might not be the real ones, since we are healthcare personnel are watching that it doesn't correspond to the amount of people that we're seeing sick and that we're seeing dying. So, but that's the official number. So we're gonna divide the COVID crisis or the COVID pandemic in health system, economics, and country, like in general, and medical students. So the health system has been collapsed since the pandemic began because we have a private health system and a public health system, but in a public health system, which is the one that the most of the population has access to, we don't have the we have a lack of medicines, lack of diagnosis equipment, lack of personnel, even due to the Venezuelan migration all over the world, and it's really difficult. It has been like really difficult. We don't have a PCR test. We only have quick tests for COVID that are given for free. for the government, and but the only hospitals that can apply the test are those that were like send or mandate from the government. We only have like maybe 4 or 5 hospitals, like here in Caracas, in the capital, that are making the quick test, and we don't really have PCR. So you might give a false negative or a false positive with the quick test, and you're still going to be in the statistics as a non. I mean, you're not going to be, or you're going to be a positive even when you're not, because we don't have PCR. We don't have a way to confirm that you actually have COVID. It's been getting worse because since we started to register the peak maybe a month ago, our health system totally collapsed. We don't have beds, we don't have mechanical ventilation, we don't have ambulances, we don't have any type of enzyme, and we don't have health personnel. So the government had to take over hotels to be able to isolate positive people, but they are isolating asymptomatic people with severe cases of COVID. And they're isolating them in these hotels without medical care and without food and without water, and their families are not allowed to see them. They can barely communicate with people outside the hotel. And so people is avoiding to go to hospitals and make the quick test, even if they're feeling really bad, because they're scared that if it's not COVID and they got a false positive, they would be like forced to stay in these hotels without food, without water, without medication, and without being able to communicate with anyone. So yeah, we don't have real statistics also for that, because people are so afraid they don't go with they don't go to hospitals and they don't make the test. So we also have this thing Chile has, the telemedicina. The doctors, the Venezuelan Society of Infectology, as well as the Internal Medicine Society, and many recently graduated doctors are doing online consultations to people with symptoms or scared or anything. Actually, they just making online consultations to avoid, first, to collapse the health system more than it already is, and second, to avoid that these people, in case of positive, are forced to stay in these hotels, because they're getting actually worse. People that might be asymptomatic or a false positive are resulting in a real positive or a really severe COVID cases, since they are in close contact with the severe case. Baby. Well, and well, we don't have, again, mechanical ventilation, so our deaths probably are more than what I just told you. They're probably more than 300 deaths. I mean, I'm seeing like friends and family dying and teachers dying every day. So that's another important point. Our healthcare personnel is dying. Rate is alarming. We have from all the deaths, and this is not reported officially, we have like 23% of deaths that are healthcare personnel, because we don't have the personal equipment, the right equipment to protect ourselves during this pandemic. I mean, I speak for all, but I'm a student, so I'm not forced to go to the hospital. But our teachers and the interns, they are forced to go to the hospital, and they are not provided with any equipment. They have to buy everything by themselves. And if they don't have how to buy it, because we are in an economic crisis, then they just have to deal with it, to go and deal with it. I mean, and they're dying, because we also, again, have a lack of medication. We don't have a way to protect or to heal or to help. Well, that's for the health system. In the economics, we had a study made to measure the impact of the COVID in the economy. It's very brief, but I can quote you that 43% of the country's household in this study reported inability to work or a loss of income. Our government, since even like way before the pandemic, like 2013 or 2015, they started to give this bags of food to the people with low incomes, and they like kept giving it even in the pandemic, but the bags were delayed. Like right now, these bags of food are really delayed. They might get 2 months or 3 months to get to your house, and if you don't have an income, then you don't eat, because the government is the one who guarantees the food and they are not delivering it in time. So, and they also transfer money even before the pandemic. They also transfer money for many reasons to people that were registered in a special system they made. And now in the pandemic, they kept the bonus, the transfers, but they like $5 maybe a month. There are people that receive maybe $10 or $20 a month. And again, I'm telling you, this is a country with a dollarized economy. Even when we don't receive dollars, everything can cost around $5. Like food stuff, it's really weird to see things under $5. So it's hard. Even with the bonus and transfers from the government, the people is starving. A lot of people are homeless. You see them like sneaking in the trash with small children. They're getting disease, and we cannot treat them or help them in any way because we don't have the economic availability to help them either. And yes, so that with the economic, with the universities and schools and how it's been like all the education system working since the pandemic. Primary and secondary schools have
Pessoal, acho que travou a conexão dela. Vou esperar ela voltar. I think she lost her connection, and let's wait for her. She'll come back soon. Galera, para quem está acompanhando a gente aí, o link do certificado já está disponível aí na bio do evento no YouTube. Pode preencher lá, vai ficar disponível por um tempo, a gente já vai tirar daqui a pouco. Se inscreva no canal da DENEM, também no Instagram, DENEM-Brasil, no DENEM-Brasil com Z e DENEM-BR. A gente está postando todos lá. Vamos ter uma rodada de café com prosa, né? Então, teremos mais a partir da semana que vem. Thank you for coming back. Now you can continue.
I'm sorry, my internet connection is like really, really bad.
No.
So I forgot where I was. About education system, I was talking about primary and secondary school. They were suspended and will remain suspended till further notice. I mean, we don't really know. But the Minister of Education spoke about online education for primary and secondary schools, they actually got graduated and finished their years online. But for college education, we have, again, private and public college education. But we only have public medicine schools. So for the private colleges, they are seeing online classes. They are really going through the pandemic with online classes. But for public colleges, and this applies for for medicine students around the country as well, we are not seeing any online classes since the beginning of the pandemic. Since many of our students don't have a stable internet connection, as you could already see, and they don't even have electricity. This is a problem that's been affecting our country since 2019. The capital has electricity, has the most stable electricity system, but the rest of the country has severe failing in their electricity system. They can spend like 10 hours per day, every day, without electricity. And that will make like really difficult for every student to attend to an online class. Even, I mean, it would be even worse if this class was mandatory, or if we had to have tests and stuff they couldn't attend. So public universities decided not to have online classes and benefit of their students, and we are just resting in home. Some universities, some medical schools have been given priority to those internship students, to the interns. They are actually, some of them, they are actually going to hospitals, but as I mentioned before, they are not provided with the right personal equipment, personal protection equipment. They have to buy everything, and they have to take care of themselves. For the interns, going to the hospital and being in contact with patients, even if they're positive or not, is mandatory. For example, here in Caracas, in the capital, the interns are not in the hospitals, are not in classes. They are as suspended as the rest of us. But in the rest of the country, there are some universities that have been having interns in their hospitals. Um, well, yes. Our government at the beginning of the pandemic, they said that we as students, as last year students, like fourth, fifth, I'm sorry, and sixth, that are the interns, years of medicine, could go to the hospitals and help, since we have a lack of personnel. But it was volunteer. It was totally volunteer. They wouldn't force us to do anything, but they wouldn't allow us or give us the right personal protection equipment. So, and we had to be in contact with patients, with the indirect contact. So a couple of friends are there in the hospital every day as volunteers, helping with the diagnosis of patients, but they don't have personal protection. Say they don't have it, and they're still going, they're still risking, even though they know the rate of health personnel deaths is really high. We are expecting, at first, we were expecting our peak of cases for June, but in May, see, in May, our government started opening things. They stopped the lockdown and start like opening stores and letting us out. And people here don't respect the social distancing. People here don't like to wear face masks. They don't like to wash their hands. They don't respect the distance when they go out, and they go out like a lot of people together, even if they don't need it. So when our government opened everything up, it got worse, way worse. And right now we are expecting our peak for September. We are registering a high number of cases every day and a high number of deaths every day. To that, we have also um, the imported cases, they call it, because migration in Venezuela is really a thing. And all of these people that were living outside of the country and didn't have a good income or a stable income, they lost their jobs, and they were starving, they got homeless, so they decided to come back. Even though our frontiers are closed, they are finding a way, because our government is allowing like 300 people every 3 days to come in past different years, but they have to pass 14 days of isolation once they get to the country. And this has also been an important factor for our cases. And also, in addition to that, we, as I mentioned, we don't have any official data. So unlike Canada and Chile, we don't really know when or how do they pretend to finish the quarantine. How many cases do we really have? I don't know. How many deaths do we really have? I don't know. And I don't think we are going to know ever. So yes. For now, what's happening now, right now, today in Venezuela, we have again a transition and reopening of everything. We have this system the government calls 7+7, and it's like 7 days of quarantine, of lockdown, and 7 days of freedom. And I say freedom because they call it like a partial lockdown, but it's not true. Like all of the stores are open, all of the people goes out, and as I said, they don't respect social distancing, they don't have personal equipment, and they don't like to use it, even if they have the equipment. So it really is not helping with the peak of cases we're having, but that's what we have right now. And how are we dealing with all of this as medical students, as NMO, as person? We are staying home. From our NMO, we're hosting a lot of webinars and a lot of conferences to educate people about the COVID and how to protect themselves. We're having a lot of campaigns and online campaigns, and we'll be probably hosting our national GA online because we had to cancel every event this year. And even if the government opens the pass between the states and the regions and in the frontiers, we don't think it's safe for our members to go out of their houses for what's left of 2020. So as a person, as a medicine student, like me personally, staying home, taking as many online courses and classes, even if they're not from my university, and doing the best I can to protect myself and my family, to educate the people around me, and to learn new stuff for the moment when I can go back to college. So that's all for Venezuela. If you have any comment or any question, feel free to write it, and I'll feel happy to answer.
Fabiola, thanks for your presentation. It was really awesome. We live in different countries, but we can feel relatable to you. And yeah, it's really sad how like South America is dealing with pandemic. But I have a question for you. Do you feel like there are so many speculations about false treatments? Because here in Brazil, we hear a lot about chloroquine and stuff like this. Some treatments that doesn't work. So do you feel like there are many speculations on social media about this?
I'm sorry, can you repeat? Because my internet got me out again.
Okay, so I was asking if do you feel like there are so many speculations about false treatments? Because here in Brazil, we hear a lot about chloroquine and ivermectin, which like doesn't work. So do you feel like on social media, especially, people are like speculating about something that might treat, but in fact it doesn't?
Yeah. If you could type me the question or something, because I hear you like all cut and I can't really understand the question. I'm sorry.
Okay.
I heard something about speculation and social media.
about false treatment. How will you type it?
Is this a question or is?
Okay, type it.
Okay, so let me. Do you feel like there are so many speculations? Yeah, there are, and our country's been treating like here, our government's been treating people with it's been treating even asymptomatic people with unproved treatment. They're just like giving anything to any. We have a lack of medicine, and they are like just giving away every medicine they come out with, and it doesn't really help. It is, I think personally, it is a really big speculation with treatments, not only in Venezuela but in the world, because I've seen that many friends in other countries are telling me the same. Like here, they are treating people with things that haven't been really proved to work. Here in Venezuela, private centers are treating only the severe cases and are giving like remdesivir, or they were giving another thing, but I don't remember. But here we don't have that. So people that is taking care in private centers and they need this medicine, they have to import it. They have to bring it from the US or any other country, and it's really expensive and hard to get. So it's difficult.
All right. Oh, we have this other question here.
Yeah.
Paloma asking you.
Let me see, because it stopped showing.
Okay.
Okay, if you can show the other question again in the screen, then because it stopped showing and I don't remember it.
Okay, I'll show it. It's in the comments.
Okay. So
No, this one you have already answered, right?
no, this one, I mean, I talked about it, but I didn't answer this question. I haven't heard about any student who have been infected by being a volunteer, thanks to God. But I have a couple of teachers that died while being volunteer. I saw the question in the chat box. It was from Paloma, I think.
Yeah, it is from Paloma, the other one. So, do you know about any students? How are they dealing with this? Like work in a hospital?
I mean, we they are volunteers. I don't know exactly why are they doing this, considering they have like risk groups inside their families, each one of them, and they don't get the right personal protection equipment. But I don't have any friends or any person I know as students infected with COVID-19 from these people that are volunteering. All I know is from teachers that have been infected and died from corona while being volunteers, because in this country public medicine is not well paid, so all of these teachers are really volunteers.
I see. All right. So thank you for your presentation. It was really awesome. Like people loved it, and I'm really sure you add so many new things for us.
Yeah. Thank you for having me
So
again.
no problem. It is our pleasure to have you and the other ones. And now we're gonna like finish it. Thank you everyone for being here with us. Like let's put everyone on the screen again. Thank you
Thank
girls for being
you.
here. It was really awesome. You three were great, and I hope we can do more. I hope we can talk more always.
It's so interesting to get everybody's perspectives, and thank you, Paloma and Fabiola, as well, because we don't hear a lot about what it's like in South America. So I really appreciate you sharing.
All right.
Thank you, Angie. And thank you, Lucas, for inviting us today.
There's no problem. It is
Thank
my
you,
pleasure
everyone.
to talk to you. So now we're gonna have our regional coordinator. He's gonna speak like a little bit about Brazil, just to finish it, right?
Okay.
I was muted. I was speaking, so sorry. Hello, everyone. Good morning. My name is Iago. I'm a regional coordinator from the DENEM, and I'll talk you guys a little about the situation about pandemics in Brazil. Actually, I'll talk about a statement we made in the OGA. Last week or last weekend. I don't remember the date exactly, but it was a test, lives over profit. And we in this statement we talk about the Brazil reaching 100,000 deaths caused by the pandemic of COVID-19 in our country, which has more than 200 million people that live in different parts of the country. We have different cultures and regions. Like I'm from the northeast region of the country. Lucas is from the southeast. So it's a very big country, and we have a lot of difference in cultural and economic and these things. So the impact of COVID-19 in Brazil was due not only on the potential of threat to the virus, but also the lack of effective response by the crisis sorry, I'm a little nervous, by our government. We've been taking about the power of the false words and news in our times, but it may be easy to gauge how much these factors actually affect people's health. With statement from the president like, "I'm not an undertaker, okay? So what? I'm sorry. What do we want to what do?" When he asked about the number of the deaths and infections in our country, so the president, he's like using he's not actually he's ignoring the demand of the people and using the medications like Lucas said, chloroquine and extraordinary measures like, oh, I'm an athlete, so I have a good health history and I cannot be contagious by COVID. So things like this. And in August, Brazil entered in the 50th month of the social distances with more than 1,000 deaths per day, with virtually no state strategy to control the threat. In addition, we have a high rate of unreported cases in this territory. So notifications uh, happens, but now we know that we have a lot of more cases than they show in the news. Uh, we are the country with the most deaths among the healthcare professionals, and the president was considered the worst leader in the fight against COVID by the Washington Post. The attitudes are also detrimental to leaving the country out of the license with the WHO, the World Health Organization for Future Treatments and Vaccines. Right now, we face irreparable losses for our country history. Indigenous people are the most affected at the moment. There are more than 148 ethnic groups confirmed with the cases of coronavirus, more than 23,000 infected, and 640 deaths. Most deaths are concentrated in Amazon regions, the north of Brazil, a forest that tries to survive and resist deforestation that grows month by month with the government measures. In the beginning of this year, we had a situation in Amazonia with the burnings, and the deforestation is really growing, even though we are in pandemics and social measures of distancing the states apply. So, on the other hand, we have our unified health system, the SUS, which provide Brazilian people with free treatment and the fight against COVID-19. So, like I was seeing yesterday, a COVID test in private service is like 250 here where I live, 250 reais. And the SUS give it free. So people actually can be tested PCR for free in the SUS. SUS is the key point of discussing public health from another perspective. Bring the light once the important discussion on universal access to health. In the meantime, we're still facing the impacts of the neoliberal measures aimed at dismantling our health system and favor open and first private health sector. So SUS is a really a victory of the people demands on the 88 Constitution Brazilians, where we leave the dictatorship and began the redemocratization process. And it's something we Brazilians are very proud of, but it's under constant attacks of the private sector to try to take this system and begin to bring the more paid service to it. So like the service now is free. In the future, with these measures, may now be a fee to people to use it like in other countries. So at DENEM, we fight the rights for the people to have universal, free, and quality health. Only this way we can build a more justice society for everyone. Health for us is not a commodity. It should not be a source of profit. Health is a universal right guaranteed by the Article 6 of the Brazilian Constitution. 100,000 deaths in Brazil is more of them were preventable. They're not just numbers. There are 100,000 stories, lives, and loved ones. We are here today in memory of the victims to honor their stories and their families. Today, in the day that we read this statement was the indigenous people of the world. So we actually felt this statement like with a very sadness in our heart because of the indigenous people, who's the most population in Brazil who's suffering with the COVID, is taking a huge impact of cause the virus. So yeah, it was like this. The situation in Brazil of the pandemic. Sorry about my English. I was very nervous today because I'm not used to talk in English. And thank you, guys.
Thank you, bro. It was really awesome, and you did summarize like Brazil's situation really well. So if no one has like any other question, we're gonna finish it. Once again, thank you, girls. Thank you, Angie. Thank you, Paloma. Thank you, Fabi, for being here with us. It was really important. Everybody liked it. And I hope we can meet again. We can do like more webinars with you girls. It was my pleasure to know a little bit more about your countries, and I'm sure everybody liked it.
Thank you, Lucas.
Thank you. Bye.
Thanks to everyone who watched.
Bye. Thank you. Kilan says bye as well, but he had to leave early.
Oh yeah, say thank you to Kila as well.
A DENEM é de quê?
De luta!
E a DENEM é de quê?
De luta!
A DENEM é de quê?
De luta!